Hello and welcome. Today, we're diving into a less common, but crucial, type of heart failure: high-output heart failure. While most heart failure involves a weak or stiff heart struggling to pump effectively, high-output heart failure is a different beast entirely. It occurs when the heart is working overtime, pumping out an abnormally large amount of blood, yet still failing to meet the body's heightened demands. So, what causes this relentless overwork? The etiology of high-output heart failure is diverse, but common culprits include severe anemia, where the body demands more oxygen-carrying blood, hyperthyroidism, where an overactive thyroid increases metabolic rate, arteriovenous fistulas, abnormal connections between arteries and veins that bypass normal capillary beds, beriberi, a thiamine deficiency, Paget's disease of bone, and even pregnancy. Each of these conditions places an unusual burden on the circulatory system, driving the heart to pump harder and faster. Let's get into the pathophysiology. In high-output heart failure, the heart is initially able to maintain the increased cardiac output, but over time, the constant strain leads to several changes. The heart muscle can enlarge and thicken, a process called hypertrophy. This hypertrophy initially helps the heart pump harder, but eventually, it can impair its ability to relax and fill properly. The increased blood volume also leads to increased venous return, pulmonary congestion, and ultimately, the same symptoms seen in other types of heart failure, despite the heart initially pumping a greater amount of blood. High-output heart failure is relatively rare compared to other forms of heart failure, making it difficult to pinpoint precise epidemiological data. Its prevalence is largely dependent on the prevalence of its underlying causes. For instance, regions with higher rates of untreated hyperthyroidism or severe anemia might see a slightly higher incidence. However, accurate and comprehensive epidemiological studies specific to high-output heart failure are still limited. The signs and symptoms of high-output heart failure can overlap with those of other types of heart failure, but some key features may hint at this specific condition. Look for shortness of breath, especially with exertion, swelling in the ankles, feet, and abdomen, fatigue, and rapid or irregular heartbeat. Other clues might include warm extremities, bounding pulses, and a widened pulse pressure, the difference between systolic and diastolic blood pressure. The presence of signs and symptoms related to the underlying cause, such as thyroid enlargement and hyperthyroidism or pallor and anemia, can also aid in diagnosis. Diagnosing high-output heart failure requires a careful evaluation, including a thorough medical history and physical examination. Key diagnostic tools include an echocardiogram, which can assess heart structure and function, including cardiac output, blood tests to check for underlying conditions like anemia, hyperthyroidism, or thiamine deficiency, and potentially cardiac catheterization to directly measure cardiac output and pressures within the heart. Ruling out other causes of heart failure is also crucial. Unlike some other types of heart failure, high-output heart failure doesn't have distinct classifications or types beyond the underlying cause driving the condition. The focus is always on identifying and addressing the root of the problem, whether it's correcting anemia, treating hyperthyroidism, or managing an arteriovenous fistula. The primary goal of treatment is to address the underlying cause. For example, treating anemia with iron supplementation or blood transfusions, controlling hyperthyroidism with medication or surgery, or closing an arteriovenous fistula. In addition to treating the cause, medications commonly used in heart failure, such as diuretics to reduce fluid overload, ACE inhibitors or ARBs to reduce the workload on the heart, and beta blockers to slow heart rate, may also be prescribed to manage symptoms and improve heart function. Preventing high-output heart failure focuses on preventing or managing its underlying causes. This includes ensuring adequate nutrition to prevent deficiencies like thiamine deficiency, routine screening for and treatment of thyroid disorders, and careful management of conditions like anemia. Early detection and treatment of these underlying conditions can significantly reduce the risk of developing high-output heart failure. The prognosis for high-output heart failure depends largely on the underlying cause and how effectively it can be treated. If the underlying condition is readily treatable, the prognosis can be quite good. However, if the underlying condition is chronic or difficult to manage, high-output heart failure can lead to significant morbidity and mortality. Recent research is focused on better understanding the complex interplay between various underlying conditions and heart function, aiming to develop more targeted therapies to improve outcomes in patients with high-output heart failure. As diagnostic tools improve and our understanding deepens, so too will our ability to manage and improve the lives of those affected by this challenging condition.